In this video by deckplate we will understand the VA rating for diseases of the peripheral nerves, all radicular groups, the musculospiral nerve, radial nerve, the median nerve, the ulnar nerve, musculocutaneous nerve, circumflex nerve, long thoracic nerve. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. All radicular groups, diagnostic code 8513. The radicular groups consist of nerve roots that branch off from the spinal cord and control various muscles in the limbs. Complete paralysis of all radicular groups results in severe impairment of limb function warranting major rating 90% and minor rating 80%. Incomplete paralysis. Severe. Major rating 70%. Minor rating 60%. Moderate. Major rating 40%. Minor rating 30%. Mild. Major and minor rating 20%. The musculospiral nerve, radial nerve, diagnostic code 8514. The radial nerve controls the muscles responsible for extending the wrist and fingers, as well as supinating the forearm. It also helps with elbow extension and the synergistic movements of the hand. Symptoms of complete paralysis include hand and finger drop, wrist and fingers perpetually flexed, thumb adducted, inability to extend the hand at the wrist fingers or thumb, weakened supination and extension of the elbow, impaired hand grip, and rarely total paralysis of the triceps. Major rating 70%. Minor rating 60%. Incomplete paralysis. Severe. Major rating 50%. Minor rating 40%. Moderate. Major rating 30%. Minor rating 20%. Mild. Major and minor 20%. Note: lesions involving only dissociation of extensor communis digitorum and paralysis below the extensor communis digitorum will not exceed the moderate rating. The median nerve, diagnostic code 8515. The median nerve is responsible for the fine motor skills of the hand, including thumb opposition, wrist flexion, and finger flexion. Complete paralysis. Symptoms include the hand inclined to the ulnar side, extended index and middle fingers, significant muscle atrophy in the thenar eminence, thumb in the plane of the hand, apand, defective pronation, inability to make a fist, extended index and middle fingers, inability to flex the distal phalanx of the thumb, defective thumb opposition and abduction, weakened wrist flexion, and pain with trophic disturbances. Major rating 70%. Minor rating 60%. Incomplete paralysis. Severe. Major rating 50%. Minor rating 40%. Moderate. Major rating 30%. Minor rating 20%. Mild. Major and minor 10%. The ulnar nerve, diagnostic code 8516. The ulnar nerve controls the muscles involved in finger abduction and adduction, as well as some wrist flexion. Complete paralysis. Symptoms include the griffin claw deformity, marked atrophy in dorsal interspace and thenar and hypothenar eminences, loss of extension in the ring and little fingers, inability to spread the fingers or adduct the thumb, and weakened wrist flexion. Major rating 60%. Minor rating 50%. Incomplete paralysis. Severe. Major rating 40%. Minor rating 30%. Moderate. Major rating 30%. Minor rating 20%. Mild. Major and minor rating 10%. Musculocutaneous nerve. Diagnostic code 8517. The musculocutaneous nerve controls the muscles that flex the elbow and supinate the forearm. Complete paralysis. Symptoms include weakness but not loss of flexion of the elbow and supination of the forearm. Major rating 30%. Minor rating 20%. Incomplete paralysis. Severe. Major and minor rating 20%. Moderate. Major and minor rating 10%. Mild. Major and minor rating 0%. Circumflex nerve. Diagnostic code 8518. The circumflex nerve controls the deltoid and teres minor muscles, which are responsible for abducting and rotating the arm. Complete paralysis. Symptoms include the inability to abduct the arm and weakened outward rotation. Muscles affected are the deltoid and teres minor. Major 50%. Minor 40%. Incomplete paralysis. Severe. Major rating 30%. Minor rating 20%. Moderate. Major and minor rating, 10%. Mild. Major and minor rating, 0%. Long thoracic nerve diagnostic code 8519. The long thoracic nerve controls the serratus anterior muscle, which is crucial for lifting the arm above the shoulder and stabilizing the scapula. Complete paralysis. Symptoms include the inability to raise the arm above shoulder level and winged scapula deformity. Major rating, 30%. Minor rating, 20%. Incomplete paralysis. Severe. Major and minor rating, 20%. Moderate. Major and minor rating, 10%. Mild. Major and minor rating, 0%. Note, ratings for combined nerve injuries should reference the major involvement or consider radicular group ratings if sufficient in extent. Thank you for watching this video. Please don't forget to subscribe and like our videos.